Cancer cachexia is an insidious syndrome that not only has a dramatic impact on patient quality of life, but is also associated with poor responses to chemotherapy and survival. Although skeletal muscle loss is the major characteristic of cachexia, loss of fat mass also plays an important role. If we are focusing on lipid metabolism and cachexia, brown adipose tissue, or BAT, is very important. The primary function of BAT metabolism is the production of heat, also called thermogenesis. It was already known that brown adipose tissue is only present in babies. Recently, also bright or beige adipocytes are found in human adults. Bright adipocytes are formed out of white adipocytes and have the characteristics of brown adipose tissue. Different pathways are involved in the development of cachexia via an increase in lipid mobilization and an increased energy expenditure due to thermogenesis, mediated by chronic inflammation and the parathyroid hormone-related protein, or PTHRP. In this movie, we will explain how cancer alters lipid metabolism and thermogenesis, causing cachexia. This subject was discussed by Graham Robertson. Graham Robertson is currently working at the School of Molecular Bioscience, University of Sydney. Furthermore, he is doing research with the Garvan Institute of Medical Research in Australia. The previous work of Dr. Graham Robertson mainly focused on pharmacology, muscle wasting, cancer, and inflammation. We will discuss the pathways one by one, and after that we will give you an overview of all the pathways. The loss of fat mass is induced by the tumor itself, via the stimulation of chronic inflammation and the upregulation of PTHRP. PTHRP binds to its G protein-coupled receptor and thereby also stimulates the PKA pathway. The lipolysis in visceral white adipose tissue, or WAT, results in an increase in fat depletion, which contributes to the development of cachexia. In subcutaneous WAT, the fatty acids contribute to the browning process, resulting in bright adipocytes. Furthermore, UCP1 is stimulated by fatty acids, resulting in an increase in thermogenesis. The fat browning and the increased thermogenesis increase the energy expenditure level, also contributing to the development of cachexia. UCP1 is the central mediator of thermogenesis in BAT. UCPs are transmembrane proteins that decrease the proton gradient generated in oxidative phosphorylation. They do this by increasing the permeability of the inner mitochondrial membrane, allowing protons that have been pumped into the intermembrane space to return to the mitochondrial matrix. UCP1-mediated heat generation in brown fat uncouples the respiratory chain, allowing for fast substrate oxidation without ATP production. The tumor induces chronic inflammation, characterized by the upregulation of the pro-inflammatory cytokine interleukin-6. This cytokine stimulates various pathways which are involved in thermogenesis and fat depletion. The major pathway influenced by interleukin-6 is the beta-adrenergic pathway, which is controlled by the hypothalamus via the sympathetic nervous system. Interleukin-6 stimulates development of M2 macrophages, which stimulates production of catecholamines such as norepinephrine. These catecholamines bind to beta-3 adrenergic receptors, which stimulate cyclic AMP. Cyclic AMP activates PKA, which has multiple downstream targets. PKA is responsible for the phosphorylation of the lipase pyrrolipin A and hormone-sensitive lipase, HSL. This leads to the hydrolyzation of tri- and diglycerides into fatty acids. Those fatty acids activate UCP1 protein activity. Unphosphorylated pyrrolipin A covers triglyceride droplets, but when it's phosphorylated, it dissociates and the droplets become available for HSL and WAT lipolysis is enhanced. PKA also activates protein expression of UCP1 via PGC1-alpha. Furthermore, PKA is involved in the activation of the MAPK38 pathway that leads to increased UCP1 expression. This pathway is also activated by interleukin-6 via AMPK. AMPK is normally a fuel-sensing enzyme that responds to a decrease in cellular energy state. It enhances processes that generate ATP and inhibits others that consume ATP but are not necessary for survival. In cancer cachexia, this process is disrupted by the increase of interleukin-6. Another interleukin-6 stimulated step is the STAT3 signaling, activated in brown adipose tissue. STAT3 elevates the level of UCP1 in blood. Besides the function on UCP1, STAT3 is also involved in muscle wasting. In conclusion, tumors can induce chronic inflammation, which will lead to severe cachexia. In cachexia, the patients have more heat production because of altered metabolism and more depletion of fat tissue. Cachexia increases the risk of getting weakness and has not only an impact on physiological but also on psychological well-being.